Good afternoon, everyone. Welcome to the second of our three-part webinar. Sorry, there was a little echo there. All right. Sorry, we're having a bit of a technical difficulty. All right. All right, good afternoon, everyone, and welcome to the second of our three-part webinar series dealing some of the critical changes that are coming to our CAPS program. I'm Bentley Ponder, and I'm obviously kicking off this webinar. And here with me in our somewhat stately control room, headquarters, I guess you could say, are our other presenters, Elizabeth Casper, Deputy Commissioner for Federal Programs, Heather Young, our Education and Outreach Consultant, and then Ann Pazika, our Education and Outreach Manager. I do want to point out that we have some other special friends in the room, Kay Mayfield, who is our Director of Provider Relations, and Woody Dover, who is our Enterprise Director at DeKalb, and I like to just say architect of many things data, are also here and will be able to answer questions when we get to that Q&A portion of the webinar. Next slide, please. So, as I mentioned a few minutes ago, this is the second of our three-part webinar series. On July 10th, we talked about some of the new policy changes and changes to the program as a result of Access Conclusion. That webinar is posted on our website. I think there's a later slide that actually gives a specific link to the webinar, and then some of the questions that we were unable to answer in the Q&A are also posted as well. Today, I'm excited to say that we'll be talking about some changes to our rate structure, particularly our base rates, and then we'll also go into the process for how we update those rates. So this is both a policy level and then also a webinar with a lot of technical support. And then on August 13th at our third webinar, we'll talk about changes to our tiered reimbursement program, some new QR workforce bonuses, in other words, workforce bonuses related to quality rated, and also some different resources and supports that we'll be offering through our Thrive Business Academy. All right, next slide, please. So here is the agenda for today. Once we get through this quick introduction, I'm going to turn it over to Elizabetta, and she'll provide a bit of the context setting for today's webinar. All told, we have some big changes coming to the CAPS program, and it is important that we go through the why and really talk about the context with these, because there's a confluence of events that have kind of come together that are really leading to many of these changes. So after Elizabetta does the why, then I'm going to turn to Ann, who will go into a lot of the what and what we mean with the new state maximum reimbursement rates, which is something I always get a little tongue-tied in saying. And then from the what, we'll go to the how and the when, where Heather will talk about how to change those provider rates and some of the key deadlines that you'll want to know with that. All right, next slide, please. And then last but not least, and I know we talked about this in our last webinar, but we know there's a lot of friends that are part of this, that have joined, that aren't necessarily providers, but we have designed these specifically for providers. And so you're going to see today a lot of policy, but you're also going to see a lot of technical support and some really in-depth how-to slides. So just want to point that out. We will be doing more and more outreach as we get closer to some of the key dates, and we'll talk a little bit more on the policy level, but these really have been designed and are geared towards our CAPS providers and just providers in general. And with that, I'm going to turn it over to Elizabetta. I will just kind of close in saying that in typical times, these would be really major changes. I kind of consider this almost atypical times with the ending of our American Rescue Plan funding, the beginning of our new CCDF state plan, and just the success we've had in serving children over the last 2.5 years. So, big changes, typical, but really big changes when you consider the atypical times we're in. And with that, I'll turn it over to my friend Elizabetta.
Thank you, Bentley. Hi, everybody. I'm Elizabetta Casper. I am the Deputy Commissioner for Federal Programs for federal programs here at DECAL, and I oversee the Child Care and Parent Services, or CAPS program. So I wanted to talk to you a little bit today about the big picture, sort of the why behind why are some of these changes happening? I think you know a lot of this, and some of you who were tuned into the webinar, the first webinar, will have heard some of this already. However, I think it's really worth hearing more than once because there's a lot of information, and I'm talking about the part I'm going to do. The parts that the other people after me are going to do are all brand new, different information. But it's worth hearing it again. And then, of course, I'm sure there are people tuned in who were not here for the first webinar. So for any of you where it's repetitive, I apologize. So let me begin with a few kind of quick facts about CAPS. So as you know, CAPS is federally funded. It's funded through the Child Care Development Fund and what we refer to as CCDF. You'll hear it referred to that way a lot. And then, of course, DECAL is the lead agency for those federal funds that are received by Georgia. CCDF pays for the CAPS program, as well as many of the other programs that DECAL administers and the functions of DECAL that we carry out. And so that might also include like childcare licensing or childcare services, our quality innovations and partnerships. CCDF funds many of the different parts of DECAL. And then, of course, as you know, since 2021, DECAL has supplemented CCDF funds with COVID-19 relief dollars, or ARP dollars, and those are expiring on September 29th, 2024. The extra funding that we received has to be exhausted or spent by September 29th, 2024. There is a hard, fast deadline on that. Which is why we keep talking about that the funding is running out or is about to run out. Relief dollars allowed CAPS to pay childcare providers their full published rate and to expand to serve over 72,000 children. Let me take a minute on that one because both of those are historical. CAPS has never paid the full published rate before we had the opportunity to do that with this additional funding. And CAPS has not served 72,000 children in a paid capacity ever before. That's roughly a 40% increase over the typical service level of 50,000. Those extra funds paid for the Access Initiative, which is paying the full published rate, as you know. And that started in May of 2021 and is still going. It's one of the only initiatives that we have in CAPS, at least, that is still underway. And it also funded that CAPS expansion where it started, in November of 2021. And what we had said was that we were going to try to support an extra 10,000 children. And just with the way that that things go, it's very fluid, the population in CAPS. And we ended up able to support an additional 22,000 children. And that's what came in, and that's what we committed to continue to support through the time that we reduced back our eligibility levels. However, once you are in CAPS, there is rules, as many of you know, about 12-month eligibility, which means we can't just take, because the initiative ends, it doesn't mean that a family's eligibility ends. So we have continued to support those children. And then, of course, the extra funds also paid for other initiatives. Many of you are very familiar with the Stable Grant and Stable Forward. And then, of course, there were a whole bunch of different grants in other areas of the department that also were funded with ARP dollars. So as I was mentioning with numbers of children, CAPS is designed to serve 50,000 children at any given time. As you may recall from prior to these initiatives, CAPS was able to serve 50,000 with the typical funding that we received from CCDF. I'm saying all this because we're going to talk a little bit about some of the changes that have to be made because we do need to go back to that 50,000 based on that funding running out that I talked about. But it's been amazing. and noteworthy that we have been able to pay the full published rate for as many years, actually, since, again, May of 2021 and through September of 2024, and have been able to pay for a historic number of families to be served and children to be served by the program since November 2021 was when this expansion began, and we still have roughly 70,000 children now. Next slide, please. So in this webinar series, we will be talking about what changes are happening now and in the coming months. Those include reducing back gradually from the current number of children being served in CAPS, that 70,000-ish that I just mentioned, to the previous service level of 50,000, which I also just mentioned a few minutes ago. Changing eligibility requirements for families in the program is the mechanism that we use to do that. And so when we adjust eligibility limits up, meaning make them wider or have higher income levels or less, other requirements, then we would let more children in the program. When we reduce them backwards and make them a little bit more strict, we would allow less children in the program. And so that is what I mean when I say that we utilize eligibility as the mechanism to impact how many children we're serving and our service levels. So this means changes to the emergency payment waivers and initiatives like access and increased tiered reimbursement coming to an end. So just quick reminder, we increased the amount that we pay in tiered reimbursement also back in, I believe, also May of 2020, November of 2021, and increased thank you, Woody, each of those star levels by 15%. That was an additional supplement to what the tier levels were prior to that time. And we also allowed our probationary and provisional programs in a probationary provisional status with quality rated to also get a 15% tier. So that all is part of those ARP dollars that have to be spent by September 29th, 2024 is coming to an end. There will be more information at the next webinar about what changes will be coming for tiered reimbursement. So, and then of course, this also means that different rates will be paid to providers for CAPS also. That's some of the other changes that are upcoming. Okay, next slide. All right, so the reasons for these changes need to occur fall into basically 3 buckets that you see up on your screen right now. So the additional funding DeKalb had is ending at the end of September, as you've already heard me talk about. And that funding was, of course, used to support access, the increased tier reimbursement, stable, and other initiatives, as well as the CAPS expansion of serving 72,000 children, or a 40% increase from our typical service levels. And then, of course, you see the second bucket, which we haven't talked about yet, CCDF, which is really the Office of Child Care, which is our federal funder. So they put out this spring new rules that also have impacts on how CAPS pay child care providers and could have further impacts to the number of children CAPS can serve. So I'm not going to go into a lot of detail about those today, because I'm sure when the time comes, we will do very specific webinars about those changes as well. They are not as immediate, even though those rules were issued in the spring of this year. We have applied for waivers for the major ones, and those waivers, if approved, would give us a couple of years to implement. And so that's what we're hoping will happen, so that we have a chance to update systems, policies, and all the various things we have to do in order to change rules. Very much like child care services issues licensing regulations, the Office of Child Care issues regulations for how we administer the Child Care Development Fund. And so very much like you have to follow rules, so do we. So we do know how that feels. But anyway, as I mentioned, we applied for waivers. And but we also have to make some changes now. So some of the changes you're hearing about in order to be prepared for those changes, even if they're a couple of years out. And then third, you see on your screen there about the CCDF plan. Bentley also mentioned it in his introduction to the webinar. So every 3 years, we have to submit a new state plan, it's called. And it's basically saying how we will administer the funds and what we will do in Georgia to be in compliance with certain rules, and then also even quality initiatives, how we plan, which ones we plan to implement and how. You have probably heard a bit about this because there were public hearings not so long ago, as well as letters and whatnot that went out. And I believe that our proposed state plan is posted right now somewhere on our DECAL website, so you can review it if you want to. It's proposed because the federal partners at Office of Child Care have to review it and approve it. And we usually get that approval sometime before October 1st, which is when it would become effective. And so this new state plan would include not only some new things and but also our new rates for childcare providers. Again, proposed at this point, but you will hear a lot more detail about those rates from my colleagues in just a few minutes. So I'm not going to go into detail about that, but the new rates will go into effect. And this is, I'm just mentioning this because it's a little confusing, because October 1st is our beginning of our federal fiscal year. However, your new rates will go into effect September 30th, because that is the beginning of the service week that starts off the new CCDF period. So, okay, next slide, please. So in summary, the changes in federal regulations, the changes in federal regulations, the end of the relief funding and the new CCDF state plan means CAPS needs to make some policy changes. CAPS needs to reduce back to serving 50,000 children, and CAPS will be paying new rates beginning with the service week starting September 30th, 2024. We recognize these changes will not be easy for the childcare community, for providers, or for families. I want to take a minute and talk about that too. So we understand that the changes that we're talking about, ending access, means that you will be paid less than you were being paid, or you are being paid under the access, because you aren't able to pay your published rates. If you charge your families the differential after access ends, then of course you would be being paid the same thing, but you're just collecting it from the family and from DECAL instead of DECAL paying all of it. But with the changes to tiered reimbursement, like that extra 15% I talked about, it's less money. So I understand that. Also, you have become acclimated to a service level of 72,000 children, which means you have more CAPS children. And we recognize that cutting back to 50,000 means you will have less CAPS children. So I just want to acknowledge that we understand that that is impactful for you, and it's impactful for the families that we serve too. So they have to pay a higher amount of money than they're having to pay right now, with only having to pay their family fee at the moment. And less people will be able to be served. Now, it will not impact people who are currently in the program who are eligible, but at least not at this point, but it will impact new folks coming in for sure. So I just want to recognize that. I also want to recognize that if you listened to the last webinar, you heard about a bunch of eligibility policy changes that we don't have time to go into today. However, you can go listen to that webinar on the CAPS website, and you'd be able to hear all those details. But those are difficult changes to make, and there are a lot of changes. They're difficult for different people, whether you're a stakeholder, whether you're a childcare provider, whether you're a family, for people to understand, whether you're one of our staff, to understand. and change the way that we process things and the way that we do things. So those changes can be a challenge. But so I just want to recognize that we all have to do this together, and there's going to be bumps in the road, and we all just, I hope, can be patient with each other so that we will not, we'll get through it together. We're going to do all we can to minimize the impact on childcare providers, workforce, and families, but of course there is an impact. So we're going to continue to communicate with you regularly and to be transparent about the changes being made and the reasons for them. We'll offer resources and supports wherever possible to help make changes understandable for both childcare providers and for families. And then, of course, as I mentioned a minute ago, we're all going to be learning and adapting together. And all these changes are going to require patience on all our parts as we acclimate to them. So with that, I'm going to turn it over to Ms. Ann Panzica, who is going to talk to you about some of the policy associated with some of our rates and rate changes.
Good afternoon, everyone. My name is Ann Panzica, and I'm the Education Outreach Manager for Provider Relations. And today we're going to be going over the proposed state maximum reimbursement rate, which I know that you've all been waiting for. And after this, we'll be discussing how you can update your rates in the Georgia CAPS provider portal. If there is anyone on your team that is responsible for updating rates in the Georgia CAPS portal, we will be discussing how to do that next. So please encourage them to join this webinar. However, this webinar will be recorded if they're not able to join. Next slide. So the state maximum reimbursement rate, or SMRR, is the maximum rate that the state pays providers offering CAPS before subtracting the family fees. Recently, DeCal conducted a market rate evaluation to understand the cost of childcare before setting rates. The market rate evaluation helps DeCal determine the market price for childcare in each payment zone. And you can see the zones right there in the map. The state maximum reimbursement rate is determined by averaging all provider rates in the designated zone. So there are some factors that affect the SMRRs. First, the SMRR is updated based on federal regulation and funding availability. After the service week ending September 29th, 2024, access expires and CAPS will no longer pay providers the differential, which is the difference between the published rate and the SMRR. When approved, the new SMRRs go into effect the week of September 30th, along with the new CCDF plan. Next slide. Under CCDF rules, states must set SMRRs for full day care that are not lower than the 50th percentile of the most recent market rate evaluation price. Those are federal rules set by the Child Care Development Fund. Georgia's new proposed rates for the full day care is actually above that threshold at the 60th percentile for the next CCDF state plan starting this week of September 30th, 2024. An SMRR at the 60th percentile is the highest rate for full day care DeCal has ever been able to offer without other supplemental funds, such as those available under Access. So this is really great news. This means that families with CAPS needing full day care should be able to enroll their children in 6 out of 10 or 60% of the providers in their market rate zone without having to pay any more than their family fee each week. Slide. So the new state maximum reimbursement rates have recently been released. Now these are proposed, and there's a link to the proposed SMRR on our webpage, and that link is right there on the slide. We will show this link again, and we'll make sure that it's on our webpage as well, which actually I think it currently is on our Provider Relations webpage. Next slide. So here are some examples of the current state maximum reimbursement rate for Zone 1 and the proposed Zone 1 rate. So as you can see, the rates increased. So in Zone 1, the rate for a toddler in a center went from $159 currently to $248 with the proposed SMRR. So that's just one example. Next slide. So here are the current and proposed Zone 2 rates. An example here is the current school age rate for a family child care home listed at $95. and the proposed rate is $135. That's just one example there too. So here are the current and proposed Zone 3 rates. As you can see, the current informal rate for an infant is $54, and the proposed rate for an informal provider is $120 for infant care. It's another example. So the changes in the payment structure are that the families will be responsible for paying the differential, which is the difference between what the provider charges and what CAPS can pay the provider. All providers may collect the differential as part of their financial responsibilities from families. Families will now be responsible for paying both the differential and the family fee if they have one assessed. And CAPS will pay either the provider's published rate or the state maximum reimbursement rate, whichever is less. This is also referred to as the base rate. Next slide. So in a moment, we're going to have Heather Young discussing how to change your rates in the Georgia CAPS system. Next slide. Before we go there, though, you may be wondering why you should update your rates in the Georgia CAPS system. And the reason for this is that rate accuracy is really important, especially now. The SMRR is increasing, which again is really great news. One of the emergency CAPS payment policy waivers implemented on May 31st allowed participating CAPS providers to charge a different rate for children not subsidized by CAPS than the rate charged by children or for children subsidized by CAPS. The policy waiver is ending September 29th, which means that the providers can now align rates charged for children subsidized by CAPS with rates for children not subsidized by CAPS. So now I will pass it off to Education Outreach Consultant, Heather Young, who will show us how to change your rates in the Georgia CAPS system.
Thank you, Ann. Good morning. My name is Heather Young, and we will first be discussing who is eligible to update rates in Georgia CAPS. For informal providers, the state maximum reimbursement rate will automatically be applied, so they will not be updating their rates in the system. The providers that will be able to update are family child care learning homes, licensed child care centers, and exempt child care centers. Next slide, please. To change your rates in Georgia CAPS, you will first need to log into the Georgia CAPS portal and navigate to your dashboard as shown. Next slide. Then select your CAPS program tile from the provider list and click on the Go to Dashboard button in the tile. Next slide. On the dashboard page, select Request Change from the menu that's on the left side to begin the process. Next slide. When you select Request Change, you will see menu options. Navigate to Manage Your Rates and use the drop-down button and select Published Rates for Provider or All Children Attending, and then select Request. The Request button will not work until you have selected from the drop-down menu. Next slide. Once you select Request, the Request Change page will populate. In the slides that follow, we will go through the step-by-step process to change your rates. Next slide. First, choose an effective date for your rates. Whichever effective date that you choose, please note that the earliest date that you can indicate is September 30th, 2024. If you choose a date after September 30th, the effective date for the rates must be a Monday. You can now begin entering values in the updated rates column. It's important to note, you will only be entering the numbers, no special characters such as dollar signs, and no decimals. Simply enter the numerical value. You also must enter a number in each box. If you don't care for an age group shown, or you do not offer the care indicated, indicate 0 as your rate. If the current rate is the same, then enter the current rate in that updated box. All fields must contain a number. You may have categories that are different from the categories listed, but your rates must align with the rate structure in the system. Next slide. If you charge a registration fee, simply add the amount that you charge for the registration fee in the Add Comments box as shown. Please do not add any other verbiage and do not add the $ or decimals. Next slide. You will need to provide documentation that shows the rates that you charge the public. Select Upload Document, and you will see a pop-up window labeled Upload File. Choose or drag the supporting document that you saved into the window. If the document appears in the window, then the upload was successful. Select Upload. Supporting documentation for rates is now successfully uploaded. After entering your rates, adding the registration fee if applicable, and uploading your rates, you can select Submit. Next slide, please. Approved documents are rates on your facility's letterhead, or you can upload the entire parent handbook if the rates can be found there. First, save the document on your device or computer. Please note that the name of the file should be your center name and not contain any special characters, or it will not upload. Only letters and numbers will be accepted as the title of the file. Next slide. It's also important to note before selecting Submit, please double check that the rates are correct and match your supporting documentation. Make sure that your documentation is uploaded and that you added your registration fee. Next slide. Also, be careful not to click on the X as shown, as it will delete your document and you will need to upload again. Next slide. You will be able to change your rates in the system beginning August 5th, 2024 in the Georgia CAPS portal. You must submit your rates by September 2nd, 2024 to ensure that they are applied by September 30th, 2024. If your rates are submitted incorrectly, you can only edit them after they are returned after review. Provider Relations is unable to make corrections or edit the rates, so we have to send them back to the provider for corrections. We cannot guarantee that your rates will be applied on September 30th, 2024, if they are submitted after September 2nd, 2024. So please make sure that you enter the correct rates before submitting them. Just to clarify, please do not wait until the last minute to submit your request. Submitting as soon as possible is recommended, as submissions received toward the end of the month may not allow enough time for corrections and resubmission for review. Slide. To check the status of your rate change, select Request Change from the menu on the left side of the page. Once you have navigated to the Request Change dashboard, you can see the status listed under Submitted Requests. Next slide. If you have any issues with submitting your updated rates, call provider support. You can reach them at 1-833-4-GEORGIA-CAPS or 1-833-442-2277. You can also email provider support at capsprovidersupport@decal.ga.gov. We will have the contact information for provider support again at the end of this presentation. And now I will turn it over to Ann to discuss how to stay up to date.
Thank you, Heather. We have the July 10th webinar available on the CAPS webpage under updates. We also have the webinar posted on the Provider Relations webpage. So this webinar is being recorded and will be available there as well if you know someone that wasn't able to attend. The FAQ from the July 10th webinar is now available on the CAPS updates page and should be posted to the Provider Relations webpage later today or tomorrow. Next slide. So we have some other ways to stay informed as well. With all the upcoming changes, we will be notifying our providers via emailed letters. So please make sure to check your email to stay informed. In addition to that, we will be updating our webpage regularly to include updates, as we stated previously. And also, this webinar will be recorded and housed there. And we have the webpage listed there for our Provider Relations webpage. Please be sure to check that. There's a lot of really great information there, a lot of resources. And we also send notifications in the Georgia CAPS portal through bell notifications and banners to relay important information. So please also check the portal when you log in too, to see if there's any updates there. So please be sure, next slide. Please be sure to check the Provider Relations webpage for up-to-date information. We actually created a tab on the page called Payment Information, which has all current payment information affecting CAPS providers. So you can find the updated proposed SMRR there. Also, a video with rate change instructions and a step-by-step with rate change instructions. And this webinar series recordings and important recent update videos and resources. So we wanted you to have easy access to this information by accessing just one tab. You can also find other resources on the site as well. I will now pass it off to Bentley Ponder to tell you about the next webinar.
Sure. Thank you, Ann. So as we talked about at the beginning, this is the second of our three webinar series. The first on July 10th really talked about some of the eligibility policies we are changing to attrition back down to that 50,000 number that the CAPS program is designed for. Today, you've heard a lot about and I always get a little tongue-tied saying this, the new state maximum reimbursement rates, what those mean for you, and then how you can put in your own rates there that will help in with that implementation. On August 13th, we're going to go to the next, what I would consider the next piece of the puzzle, where we'll talk about changes to our tiered reimbursement program. With the changes to these base rates, then we'll be making changes to how we administer and how we, how we fund tiered reimbursement. We'll also be talking about some new quality rated workforce bonuses that are part of our new state plan. And then we know that this is a lot of changes for everybody. So we will be talking about some new resources and some great, exciting resources that we'll be offering through our DECAL Thriving Childcare Business Academy. So if we've not sent out the link yet for that webinar, I'm not sure if we've sent out the registration for that yet or not, but if we haven't, that will come soon. If we have, I'm sure we can resend that again, and we look forward to you joining that. Now, shifting gears and on to some of the questions that we've been getting here. And, I'll start off with just, a couple of the easy ones. First of all, someone asked, where are the webinars posted? So, Ann just mentioned that, and those are on the provider webpage. And then someone actually asked if we could include a list of the presenters that we're talking today. So we can add that slide into this deck, or we can make sure that those are in the next slide decks when we post those. A big part today, and we recognize that this is a really big change, are talking about these new state maximum reimbursement rates. So I'm going to put Ann a little bit on the spot just for a second, because we're getting a lot of questions with that. So I'm going to try to summarize those in kind of one question. Can you just reiterate what we mean by the state maximum reimbursement rates, how that's different from provider rates, when these changes go into effect again, and just really kind of, what all this means.
Okay, so the state maximum reimbursement rate is, it's actually the amount that we're able to reimburse providers. So currently we're paying the full published rate for the provider, and effective September 29th, we'll be comparing the provider rate to the the state maximum reimbursement rate, which is, it varies by region. There's zone 1, zone 2, and zone 3, as we discussed earlier. And we'll be paying the lesser of the two. So we'll look at the provider's published rate, we'll look at the state maximum reimbursement rate, and then pay the lesser of the two. But the good news is that the proposed state maximum reimbursement rate is increasing. So, definitely take a look at my webpage, or our webpage, sorry, Provider Relations webpage, and take a look at the SMRR there. And you can see how it compares with your published rates. And then if there is a difference between the state maximum reimbursement rate and what the provider charges, then the family will be responsible for what we call the differential, what is the difference between the two. So I hope that answers your question.
That was great, Ann, and
Okay.
thank you. I mean, I really put Ann on the spot there. Just, I know you can't see us in the room, but we had all these different questions, and I thought, how can I quickly try to summarize these? And I knew that Ann would knock that out of the park. So thank you for doing that. We've also had some questions on how the state maximum reimbursement rate is computed. Like, how did we come up with these rates? So I'm going to turn it over to my friend Woody Dover here, who can talk a little bit about that and talk about just kind of that process.
Sure. Good afternoon, everybody. So I think I'll take a good opportunity to kind of give you some background and knowledge about the market rate study or survey that is done every 3 years per our CCDF regulations. The purpose of the market rate survey is to assess the price to market for childcare and inform the lead agency, in this case DECAL, on how we potentially need to set our rates for each state plan period. Currently, the Office of Child Care requires states to set their full-time rates at least the 50th percentile. So I kind of unpack how that's done. What we do is we collect those rates directly from providers. In the past, we've usually used some type of email or paper-based survey. We did things a little bit differently in this last go-around, is that we actually used the Stable Forward quarterly reporting process. Specifically, last summer, we used that process to collect the public rates for as many providers as we could. Traditional surveys, we've gotten about 50% response rate. Using Stable Forward, we were able to get responses for well over 85% of all the licensed providers in the state. So we captured only licensed providers, because those are predominantly our price to market when it comes to our CAPS program. And so we're including not only current CAPS providers, but non-CAPS providers too. Because we want to know what the entire market looks like. So how that boils down to a state maximum reimbursement rate is that you essentially, we get all that data, we bucket it based on the criteria of our rate structure. So for instance, we would take the price or the weekly rate for a infant, so age 0, for all child care centers for full-time care in market rate zone 1. And then we'd line those rates up basically from the lowest to the highest. And then that's going to tell us how, the rates distribute to providers in that population. And as it was mentioned earlier, the 60th percentile is intended to set an amount that would allow a family to find care at 6 out of the 10 providers for that particular rate without having to incur anything over and above their family fee. That's the intent. As I mentioned, the Office of Child Care currently requires at least the 50th percentile, which would be 1 out of 2. So there's no averaging in that done. However, I will just mention, anecdotally, if you go out to look at our market rate study, you will see that the average that is available for most rates is pretty close to the 60th percentile. So just happy coincidence there, but they're pretty close. But hopefully that helps answer some questions about how we decide on what is the state maximum reimbursement rate.
All right. Thank you so much, Woody. We'll go to some of the, I would say, more direct questions now. Gosh, to those big ones. So, Ann, going back to you, someone asked, where can we find what zone they are in?
That's a really good question. So if you go to the proposed maximum or state maximum reimbursement rate on the webpage, all of the counties are listed there. So we showed that map earlier. It's actually broken down. So it's a list view. You can see what county is in each zone.
That's great. And I think you mentioned this, but when will the feature for published rates be available in Georgia Caps?
It's a very good question. So August 5th is when providers will be able to go in and update their rates in the Georgia Caps portal. So beginning August 5th, you should be able to go in there and update your rates. And you should be able to see that that feature that Heather listed with the drop down where it says provider rates. You should be able to access that August 5th.
Great. Elizabeth, I have a couple questions for you. So first, provider asks, can they still charge a different rate for children with caps and children without caps?
As of right now, today, yes, because that emergency policy waiver is in place until access ends. And that's again, the end of when we will pay your published rate. However, when access ends, beginning September 30th, we will also issue a ending of that policy waiver, and you will again be required to charge the same rate to both private pay families and CAPS families. But I know this is a little confusing because we're talking about what's going to happen. But as of today, it is okay if you are charging a different rate to your private pay families than to CAPS.
Great. And then we just received a question, is the 7% parent max copay still into effect?
Yes.
And if you can explain what that is too.
Yes. So DeKalb actually implemented that several years back. We were actually ahead of the game on that one. And I think 2019, I think it was 2019. But what that is we used to have a fee that was determined in a different way for what families would pay. We moved to basing it off of the family's income and a percentage. And it is capped at 7%, meaning there's a breakdown, and we actually have some families that have zero family fee, and then some that have 2%, I think, and then 5%, and then 7%. So the 7% is the maximum, and based on where their income falls in those ranges would be what percent of family fee that family gets charged. But I think this is a good time to interject to make sure you understand the way the rates break down. So you guys charge, meaning childcare providers, charge a published rate. Then, of course, there's often a difference between the rate, not always, but often a difference between the rate that you charge and the rate that CAPS will pay. So that's what we refer to, and Ann talked a little bit about it, as the differential. That differential can be charged to the family when we're not in the middle of access, where we're paying it for you. And the family fee can be charged to the family as well. So that's that 7% or less, depending on where their income falls, that the family is issued. All of this is on the scholarship. So it says what the published rate is that you've provided to us. It says what the family fee is. And then it says, I think, parent responsibility, if memory serves, which is either the total or the differential. So those three things, the CAPS maximum reimbursement rate, the differential, and the family fee, when you add all three together, it totals your published rate.
Great. Thank you. And we also had a question, and I think this came early on, so we may have answered it, but I think it's important to go ahead and ask. Elizabeth, do the new reimbursement rates, everything that we've been talking about, do they apply only to newly enrolled children, or will they apply to all children with a CAP scholarship?
They will apply to all children. So when we change those rates on September 29th, well, they end, the current rates end, and new rates begin September 30th, we will issue all new scholarships for every single child in the program that now reflect your published rates, as well as your, and especially if you updated them early in the process and were able to have them in place by September 30th, and will reflect your new published rate. It will also reflect the new, well, there probably shouldn't be a new family fee, but the new differential if there is.
Sure. And we've had a lot of questions, and Anna, I'm not sure this is a question for you or for Heather, but about how all these changes are being communicated to families. And when will families know if if there's going to be an increase with their payment? Or maybe Elizabeth will answer that one. Sure. Asking about communication with families. When are families going to learn about the new policies?
Yes, sorry. So if you're talking about the eligibility policies that we talked about in the last webinar, parents have already been informed. We inform them at the same time as we send out letters to childcare providers. We inform everybody at the same time about policy changes. If you're talking about these changes, about our rates changing, we have been talking about with families in letters for the entire duration of access. That access will end on September 29th. And that's beginning September 30th, they will be responsible again for the differential. So we will also issue more communication to them about this, but it has, as we communicate with you, we also communicate with families.
Thanks, Elizabeth. We are getting a lot of questions here about changes to tiered reimbursement and what that looks like. And again, that will be a major topic of discussion on that August 13th webinar. I know that, some of you may be wondering about that as you're thinking of your provider rates. You will have plenty of time after that August 13th webinar to think more about your dates, your rates, because those aren't required to be in until September 2nd. If I remember correctly from the slides. So we will talk more about that on August 13th. And with that, most of the other questions are very specific. So we'll, either address those through the CAPS provider relations, or they'll be posted as an FAQ. I want to thank everybody for attending today's webinar. We really appreciate all the great participation that we had in the first one and with this one. And we look forward to seeing you on August 13th. Thanks so much.